Hello, my friends, and welcome to this wonderful edition of Heroes Headquarters, wherein we get to honor a remarkable, patient-centric colorectal cancer surgical oncologist, Dr. Usmaan Hameed from the North York General Hospital, and an early-age onset colon cancer patient, Chris Mammoliti, whose desire to live is only surpassed by his passion to now advocate for others afflicted by this disease. Chris belongs to a special subset of the colorectal cancer patient population whose disease is marked by a special mutation that may allow patients to respond to immunotherapy. Chris was not a surgical candidate right off the bat, but was most certainly a candidate for immunotherapy, and after having received 8 or so months worth of the therapy, he did eventually qualify for surgical resection of his cancer, but did feel some trepidation going into that surgery. Dr. Hameed immediately calmed Chris's fears and anxiety with kindness, thoughtfulness, and knowledge. I won't say much more, but will share with you that the relationship has blossomed to be one based on mutual respect and highly successful outcomes for Chris. So sit back, my friends, and listen to this highly inspiring story that is once again being moderated by Mr. Ryan Clark from Eversana, Canada. I promise you, you will not be disappointed. My very best to you.
Dr. Usmaan Hameed is a surgical oncologist who specializes in advanced, minimally invasive techniques in treating gastrointestinal cancers. After completing medical school and residency, he went on to pursue 2 years of additional specialization in surgical oncology at the University of Toronto, focusing on minimally invasive gastrointestinal surgery. His research interest focuses on surgical innovation, enhancing patient and resident education using 3D rectal cancer models, as well as exploring novel uses for image-guided surgical navigation in rectal cancer with the goal of reducing surgical morbidity. Dr. Hameed is also a valued member of CRAN's Medical and Scientific Advisory Board. On Christmas Day 2022, Chris Mammoliti was diagnosed with advanced stage colon cancer after a second visit to the ER. Unfortunately, this was not Chris's first such diagnosis, having had thyroid cancer at 29 and then a recurrence at 31. He started on immunotherapy treatments in early 2023, and then after significant tumor shrinkage, Dr. Hameed was able to perform surgery in October, which has left Chris cancer-free to this day. So Dr. Hameed, let me start with you. Welcome. Thank you for joining us.
Thank you for having me.
Perhaps you could tell us a little bit about, let's start with you telling us a little bit about your practice and how you support and help patients like Chris through their journey.
No, thank you for that. It's a privilege to be here supporting CRAN and supporting Chris and sharing his story. So I'm a surgical oncologist. I've been training, I trained for a lot of years to get to this point. I've been in practice for about 8 years now, and my practice is mainly patients with GI cancers, gastric cancer, and colorectal cancer specifically. And like you mentioned, I focus mainly on laparoscopic technique, but in patients that we can't do laparoscopic technique, we do it an open technique, but we really try to push the boundaries of laparoscopic technique for patients that can have access to that technology. So.
And maybe tell us about the significance of the technology that you've been trained in and that you're using versus perhaps the way it used to be done, or sort of where we've come to based on the advances that you're utilizing.
Yeah, so with laparoscopic technique and laparoscopic and robotic are very similar in that sense. I've been trained in both techniques. And we compare it to open techniques, which laparoscopic and robotic allow patients to have smaller incisions and therefore a much quicker return to work, return to to life because of the smaller incisions, the less pain that they experience after surgery, and less chance for infection and less chance for hernia. So overall, patients can get back to their life a lot quicker. And when I was training in residency, there were not a lot of laparoscopic approaches at that time to cancer surgery. We would do it in other types of surgery like weight loss surgery or other aspects of general surgery. And, part of my passion was to really try to promote and try to push the boundaries of laparoscopic technique in cancer patients. And there was really no reason why we couldn't afford these patients the benefits of that technique, and that was part of the reason why I wanted to do this field.
Very good. Thank you. Appreciate it. Chris, great to see you. Thank you for joining us. Why don't you start with telling us your story?
Yeah, I'd be happy to. First of all, thank you all for having me and for dedicating your lives and your profession to helping other people. I think it's really important, and it's an honor for me to be here with everybody, doing our best to do exactly that. My name is Christopher Mammoliti. I am 39 years old, three-time cancer patient now. At 29, I was diagnosed with thyroid cancer, recurrence coming at 31 years old. And then, as was described, Christmas 2022, we were given another unfortunate diagnosis in that the colorectal cancer was present. My story, as was touched on a little bit, did require a couple of visits. Probably on my end, and you hear this a lot, you kind of don't pay attention necessarily to the symptoms that you're developing, especially when you're a young person. That tends to go over your head a little bit, or you can attribute it to many other things that are going on in your life. And in my case, that seems to be what had gone on for a couple of years. There were things I was getting, small things like back pain, random back pain. I was losing weight, having a hard time sleeping. Near the end of, closer to the diagnosis, I was getting night sweats. A lot of those traditional symptoms that you hear about, but I didn't necessarily put them together until those hospital visits started to take place, and you start to bring those ideas into place. We went in a few days before Christmas Day to get checked. In that case, we had noticed that our hemoglobin was extremely low. And the doctor who had seen me at that time had said, if you have any other symptoms, please make sure you return to the ER, which was what I had done a few days later. My family and I did suspect something was off because of all those symptoms and starting to recognize those patterns. So we kind of knew something was going to show up on a test when we took it. Unfortunately, and fortunately, and I'll touch on that as we go, on December 25th, we were diagnosed with colon cancer. And almost immediately, the North York General team kicked into gear. Now, I say this as a patient of Princess Margaret Hospital, and they're wonderful at Princess Margaret, but it gave me a slightly different perspective on the way that different hospitals operate. When we were diagnosed, we had I don't remember the doctor's name, Dr. Hameed, you may remember the doctor's name that treated me on the day of diagnosis. But nonetheless, I was very nervous about being at North York General. I was very nervous about having the team that was there, because all you ever typically hear is that the more rural hospitals, or the ones that aren't necessarily located downtown, don't have the same supports. And that was kind of the stigma that I was walking into upon diagnosis, something that I talked a lot with my family about. Should we just go back to Princess Margaret, continue all of our, I still have checkups there every year. So should we continue there? The doctor that I had spoken with that day on December 25th, the day we were admitted to hospital, he went a long way in providing me hope that North York General was not only a great place to be, but it was the right place for me to be. One of the questions I had asked was, what would you do if it was your family member? What would you do if it was you? And the first reply he gave me was, I've sent my family to Dr. Hameed. That, for me and my father, who were in the room at the time, was very powerful to us, because it meant that it was sincere. that this person was willing to recommend a family member, a loved one, that meant to me that at least I should pursue and feel that relationship out and find out, what are the treatments that they're looking at? How progressive is this teen? And that was one of my big concerns upon diagnosis. There was a fear on my end of chemotherapy. Again, you hear a lot about the negatives and a lot of the difficulty that comes with undergoing chemotherapy. And when you're going through something like this, it's already challenging enough mentally to deal with the diagnosis itself and the real difficult potentials that can come from that diagnosis. But finding the right team, making sure that they're looking at certain treatment options, that they're going to fall into the place that makes you comfortable. And for me as a patient, that's exactly what happened, and it happened very, very quickly. Not long after that, we had said, okay, we will meet with our oncologist, who is Dr. Myers, another incredible doctor that I was blessed to have alongside on my team, along with Dr. Hameed. And they both started moving right away. I got a call from Dr. Hameed. I think it was only a few days after the diagnosis, maybe it was a week or so, to basically give me the interpretation of what the tumor board was seeing on the initial CT that we did when we were first diagnosed. And one of the things that was very important to me, again, when you're trying to feel out the relationship and the personal trust for a treatment like this, it's really important that you trust the people that are working on you and with you. And for me, when Dr. Hameed called, he paired two very important things. One was the ability to be personal, be friendly, make you feel like they're on your team. That is critical to a patient. But secondly, he was honest. And I can only imagine that would be very difficult in this type of job and role. Sometimes you see things or the potential of negativity that is very hard to share with people, but is critical for us as patients to understand and be able to start to process. I don't think that as a patient you can take healthy steps if you don't take all the information in, whether it's good or bad, and have time to develop and process. And the best way for me personally to get that was from somebody who I felt was truly on my team. One of the things Dr. Hameed said to me early on was the importance of the will to live. He told me I think our first phone call, he had said, I'm going to do everything I can for you. If we had, these were Dr. Hameed's words roughly, Dr. Hameed, please feel free to correct. He had said at the time, we could jump in and do surgery. It would be very difficult surgery. It would be a long surgery. There's a lot of risk involved. But I feel that there is a treatment, a neoadjuvant treatment, which for those who aren't aware is treatment that's done ahead of the initial surgery or attempted treatment. So instead of doing it after the fact to try to remove any remnant tissues, you're doing it ahead of time to try to make the surgery itself, I guess, more successful. I don't want to say easier, because the skill set of somebody like Dr. Hameed, I don't think he runs from the challenge, but ultimately, the best work you can do was what the team was after. And the suggested treatment at that time for the neoadjuvant treatment, which again, in my mind was chemotherapy, that was where my head was automatically going. I started to read about a week or two ahead of time. I am somebody who likes to self-educate. I never want to walk into anything. Now, that's not for everybody. Some people are better off allowing to put the full trust into their doctors, and there's nothing wrong with that either. For my personality type, I wanted to learn. I wanted to know what we were doing. And one of the first treatments that I ran into was immunotherapy. And I remember thinking, well, this would be amazing if I could qualify for something like this, or if I can be part of a trial. That was where my head was at the time, not knowing that our oncology team at the time was way ahead of me. They had already done the biopsy. They were already analyzing for, in my case, was MSI high biology, a marker. They were already walking down those steps. They had set up genetic testing to try to see if there was anything in my personal history or my genetics that would make me susceptible to the cancers, especially having 3 at such a young age, and 2, the cancers tend to be a little bit older of an onset. Now, colorectal cancer you're starting to see more of it take place in younger people, but ultimately it was a surprise for someone of my age to have 3 cancers. So they had done all of this testing long before I fully understood what it was. So to take a step back from that as a patient, when you're trying to build trust, when you walk into a path, you're on a path already that you would have liked to see once you've educated yourself. There is no better trust than that. There's no way to verbalize truly how important that is, to know that they're already ahead of you. That these people who are on your team are thinking for you, and they're thinking in your best interest. That took us to, I think it was around January, end of January, we started our immunotherapy treatments. We started, I don't remember the date, it was roughly around January 20th, somewhere in that range. And our last one was September 11th, going into surgery in October. Along the way, there was a lot of, I'd say there was a lot more positivity. When I look back on it now, there were a lot of positive steps. As a patient, the mental challenge is very real. And every single thing that can happen, you tend to spin into a negative outlook. You tend to think that's a bad sign. That becomes very difficult. So, you know, one of the things that you read a lot of in cancer patients is something called scanxiety. And what that really means is when you're going through the testing periods, that tends to be a very, very difficult point for a patient. You're waiting. You're ultimately waiting on your future, on you know, what's the potential here for me? What are the chances that I can get through this? And that's kind of what you're sitting and waiting on all the time for every test. And that becomes very difficult. And in my opinion, the most difficult part of this entire road was the mental challenge. The immunotherapy treatment was quite, if it wasn't for the mental battle, I think going to work, living your everyday life would have been absolutely possible, very possible. In my case, it was the mental challenge was a struggle, and I definitely tended to get that closer to testing points. So as we were going through that treatment journey, we were doing our scans. Again, Dr. Hameed, Dr. Myers, the entire North York General team were very proactive, making sure our scans were done on time. Another thing that I really liked was we had Dr. Hameed and Dr. Myers would be very clear, you know, maybe we should do more treatment. Maybe we should jump into surgery. There was always this back and forth. And again, that sounds like it might be conflicting, but to a patient, that's not conflicting. To me, that meant they're consistently, actively trying to find the right moment, the right opportunity to provide you a chance to get through this. So from my perspective, that was very healthy to see. And it brought a lot of confidence to me in the team that it wasn't just following a textbook. And I'm going to take a step back here a little bit. And one of the things I really loved about North York General, you know, compared to maybe some of my other cancer experiences, it was less textbook. So oftentimes in my past, what had happened was, this is what you do when you have X, or this is the solution, this is the step you take. And I think what we're starting to recognize, both as patients and in the medical field, and I shouldn't say starting to, I'm sure the medical field has recognized this a long time ago, individualized medicine, focusing on you as a person, what's your biology. All of those elements are what we're starting to see now. And this was, again, something that North York General had been way ahead of me on. That headspace allowed us to do immunotherapy off the get-go. We know, and I know I've sat in with Philomena's team, the whole CRAN team, most recently at the biomarkers conference. And you start to really understand the importance of biomarkers and the importance of them to see successful treatments. Someone like myself lived through a successful treatment. And I did that not because of me, but because of the team, because of the research, all that expertise Dr. Hameed talked about earlier that he put into his craft was something that I benefited from. Now, we see it a lot on the surgery side, but there's a lot that goes into the treatment side. So things like immunotherapy, those treatment options are fairly new, I think, to the general public, but as we're starting to see, can be incredibly effective because of their ability to zone in on an individual's biology. What speaks to me, what's happening within myself and the cells within my body. And that was kind of the way that the team again carried themselves all the way through from day one, January, all the way to October. I'm sorry, I am backtracking a little bit. I'm trying to make sure that I go through kind of the patient perspective of all of this. So if there's any questions, or please feel free to jump in.
No, that's great, Chris. We'll follow up and fill in some more. I really appreciate it. That's great. I appreciate the description. So, Dr. Hameed, let me come back to you. You know, we always ask the patient, "Oh, what's your impression of a physician?" But I also like to ask a physician what their impression is of the patients that they're dealing with. So perhaps we could start with, you know, tell me about your impression of Chris when you sort of had that first contact with him. I guess it was a phone call, that first phone call shortly after Christmas.
Yeah, I mean, it was. I mean, he did come into Emerge around Christmas time, and unfortunately, a lot of our young patients end up in the Emerge, and that's how they get diagnosed, and that's the challenge with you know, trying to advocate for young patients and trying to really promote the awareness of, you know, the risk of early onset colorectal cancer in patients that are really kind of outside the age category that we should be seeing cancers in. And often patients like Chris, you know, just because, you know, you're in the emergency department, you have a sudden diagnosis, something that's completely out of left field. You have, you know, you're working, you have a family, you have a young family. So understandably, like, you know, Chris was very, you know, shocked and very anxious. And, you know, my goal was to really just try to talk him down and to try to really organize his treatment plan and take him kind of one step at a time through the process. Because, you know, often as patients and sometimes even as providers, the first instinct is to really just jump into the OR, and sometimes, you know, that's the right choice, and often, you know, that may not be the right choice. Often we have to do something ahead of time to shrink things up or to give us a better outcome of surgery, and really trying to communicate that to Chris. And I think Chris was really receptive to the information that, you know, I was giving, which made my job a lot easier. But it, you know, often it takes multiple discussions, multiple office meetings, you know, involving family, involving loved ones to really get everyone on board with this treatment plan. And I think that was really what I was able to communicate to Chris and his family, and to get him on board with this treatment plan. It was very fortunate. You know, I have to, you know, really credit our pathologists and our radiologists and Dr. Myers. You know, our program at North York is, you know, the reason why I love working at North York is because everyone, this team is really, really focused on getting patients through the diagnosis and staging process as quickly as we can. And that's why our wait times to CT scans and our wait times to a treatment plan are amongst the shortest in the province, is because we really need a coordinated approach to get that plan in place for patients. Um, so, you know, I can't take credit for the whole program, but it does take, you know, everyone on board for this common process, and we're able to get Chris a good treatment plan. And it was fortunate that he had the MSI high, you know, moleculars, so that we could look at immunotherapy as a neoadjuvant or a before surgery approach, which I think, you know, now it's becoming more commonplace, but at the time of his diagnosis, it was really outside the standard of care. But we knew, coming from the studies that the early studies with immunotherapy, that we've seen like remarkable outcomes. And, you know, Chris is a you know, is a textbook case of that excellent outcome when we talk about immunotherapy ahead of surgery. So worked out well for him.
And can you help us understand? Absolutely. And can you help us understand? You know, Chris mentioned sort of a fear of chemotherapy, traditional sort of chemotherapy. Can you help us understand the difference between, in simple terms, I guess, you know, chemotherapy versus immunotherapy, maybe, so we can understand it a bit better?
Yeah, I mean, I think there's a lot of opinions about chemotherapy, and about, you know, the toxicity that can sometimes happen with chemotherapy. And I think it's important for patients to realize that chemotherapy is really dependent on your situation, right? And you may have had a loved one that has had chemotherapy in a certain part of their life for a different cancer, maybe end of life, and they may have had a certain outcome that may not have been favorable. But in this context, even if Chris would have been getting chemotherapy in the setting of colon cancer, colorectal cancer, often the side effects and toxicity are not what people expect. And often patients get through the treatment plan and they get to the other side of it and they come to me and they say, it was actually not as bad as I was expecting. Immunotherapy is a novel treatment. It's a different category of systemic treatment. And generally, if you are a candidate for those treatment options for immunotherapy, it really depends on the moleculars. But if you are a candidate, then often our body's way of fighting the cancer can be really, really remarkable. And we can see a lot more tumor regression and tumor shrinkage, and with much fewer side effects and less severe side effects. So, immunotherapy is really the next wave of oncology treatment, and hopefully we can get more treatment options available for more patients that have a variety of molecular testing and outcomes available. Right now, our options are still quite limited, but when we do have the MSI high patient identified, we can look at that as an option. Our site is also one of the few that do testing for MSI for every single biopsy for colorectal cancer. So that is helpful for us to get things done quick.
Very good. No, thank you for the explanation. I appreciate it. Chris, let me come back to you. You talked about scanxiety. Thank you for explaining that to us. I did want to ask you maybe to expand a little bit more on sort of the emotional impact, obviously that the diagnosis had on you, but also how maybe a bit about your emotional journey now, because you've come through this, you've had surgery, and that kind of thing, and then as well, if you wouldn't mind, maybe tying into this, I know you weren't familiar with CRAN when you were diagnosed, but maybe you can touch a bit about how CRAN has maybe provided you with support and stuff since all of this happened.
Yeah, I'd be happy to. I think when you go to the emotional side of things, you have to kind of put yourself in the moment of time. I had an 8-month-old son at the time when we were diagnosed, sorry, 10-month-old son. And I was my first child. My wife and I, we had been trying for years and years and years, over a decade of trying to have kids. We finally had our son, and we were over the moon, of course. And something like this comes about. That can really play games with your mind. It's almost like a roller coaster, where you feel like you're entirely in an amazing place. You have the family that you were hoping for. You're, in my case, a fairly young guy at the time. I was working for the Toronto District School Board. I was the vice chair of the Toronto District School Board, elected as a school board trustee for North York. Humber River Black Creek was a community I represented. There was a lot going on that was a lot of important work, a lot of things. We were just coming out of a pandemic, as we all know. The school systems were a big part of that. So there was a lot going on emotionally before any of this takes place. So when something like this happens, it never comes at a great time, right? It's kind of the saying, there's never a good time to get a diagnosis. So the emotional side is very difficult. It was a challenge because all you want to do as a young father is be there for the future of your kids, right? You don't want to widow your wife when you have a young family. So that was a very difficult thing for me to process. And going back to the importance of those conversations and having those one-on-ones with the entire North York team, but specifically Dr. Hameed and Dr. Myers, they really helped me work through some of those emotional elements. Now, as we go through, as I was mentioning earlier, there are roller coasters. You're going to come into things, symptoms that you would perceive as something negative. And this is why the communication with your team is so important. Because it's very easy to get emotionally trapped into the feelings that you're in, what's going on in your world. When if you actually take a step out, which is what Dr. Hameed really helped me do, it allows you to kind of work through those emotions and kind of work around them a little bit. I don't think they ever truly go away. And what you find again, and I mentioned it earlier, is a lot of that anxiety comes at the scanning points. So you kind of go through these stages. So there might not be any tests for a month and a half, and you feel almost like yourself again, especially with the treatment options. It was fairly easy to fall back into everything is okay, and then the scan is coming to check how are we doing. And in my case, it was very much constantly, is it having an effect? That was like step one, was, is this even going to work? Because it's, I was very lucky to have a positive result. Not everybody gets that benefit. So as you're going through those points and those checkups along the way, CT scans, blood checks, even for me, just doing our blood, they give you your paperwork and your write-up of all your numbers of your blood. I started to drive into those numbers. And what that does is it starts to create a concern every time you're about to do one, which feeds into the negative feelings that you may have as a patient. So these are kind of the things you learn as you go. I call it it's a type of maturity going through a process like this, learning how to control those emotions. But what you find again is that when you have a good team, you're able to be honest with those questions. You're able to share those concerns in a very straightforward way. And when you're with people who are going to give you a straightforward answer, it doesn't allow those negativity, or it doesn't allow that negativity or those negative thoughts to kind of take off on you. So back to the communication point, all the way through, it's very, very important. Now, in my case, when you go through something really, really difficult, it's important to, again, take yourself back and say, how can I be a positive role model? How can I, take positive steps to try to help other people who are going through something similar? And this all ties to that emotional element. Somebody who comes from a professional environment, used to working, you're in the private sector, you're grinding away and you're trying to do your best. But when you live through an experience like this and you go through those emotions, what you're left with at the end, at least for me, it was a whole. There's a piece there to say, I was in a lot of ways given a second, in my case, a third chance to be able to contribute. And I think that if you can convert that energy, your emotional energy, into something positive, I think that is the best way that you can handle that stress and emotion. An organization like CRAN, although I wasn't familiar at the time, I think is critically important to patients like myself. And now that I have a relationship with them, will be there probably for the rest of my life. You start to develop those relationships, share the feedback. It's a two-way communication point. So an organization like CRAN is trying to fight to help people like myself in their future fight, to try to help bring elements through. For example, we talked about the age of diagnosis. We're seeing a lot more of younger ages in colorectal cancers being diagnosed, which means we have to start thinking about, when are we scanning? How frequently are we scanning? What are we looking for? What are the types of new effective treatments? Again, I mentioned the biomarkers conference, the 2024 biomarkers conference that just happened with CRAN. And for anybody who hasn't had the opportunity, I highly encourage you for the 2025 conference and any others that they put on to attend. For someone like myself, I sat through and I listened, and there were a lot of experts speaking almost directly about somebody with my specifics. They talked a lot about MSI high. And for someone like me, that gave me even more knowledge coming directly from experts who do this for a living. And I think that's incredibly valuable to have local organizations who are going to do that work. A big body, a big government body, our healthcare system does its best with the resources that it has. But, you always heard the terminology, it takes a village. You need an entire community of people if you want to see progression, if we want to see better results in the cancer world. We are starting to see this. And I know there's a lot of stigma out there that, people have all these cures and nobody's doing anything with it. Well, I'm an example of a treatment that has been progressed and developed to treat something very specific and specific to my biology. So I'm in my opinion, an example that there's a lot of great work being done. And there's steps for every type. I think it's something like over 200 kinds of cancer. And they all could have different variants and different elements. So having an organization like CRAN who's going to support the advocacy, in my opinion, we should be lowering that diagnostic age. I don't think 50 is appropriate anymore. Obviously, I'd love to see it be down to 40. It becomes much more difficult to do. And I do understand there's a resource and cost allocation. But I do also think that preventative medicine has a positive impact on your cost overall to public health care. And I do think that there's more technologies coming that are going to make this a much more affordable ask. So, having patients, having doctors, and having community organizations like CRAN to pull them together and start to create that voice of advocacy. Coming from a political background, I can tell you there is nothing more important if you want to see change in a public system than having advocacy and having educated advocacy. And again, this is something that is unique to CRAN that jumped out to me right away speaking with them. They're very focused on making educated decisions. So it's not just, again, following just a textbook that was made 15 years ago. It's about, let's follow the data. What are we learning? What are the things we can continue to learn? And by having this type of leadership out there in the public space, being able, even if it's a not-for-profit or if it's a private sector organization, the reality is having them out there to be able to push and I think lean on your decision makers, I think is beyond critical. And I'm indebted to that. And it's something that I know Philomena spoke about it very quickly early on. The rest of my life will be dedicated to trying to, if it's help one person not have to go through this, that's what we're going to be doing. And having organizations like CRAN around to be able to work alongside in partnership with, I think is absolutely invaluable to the positive growth of fighting this awful disease.
Thank you, Chris. Really appreciate it.
Brian, you mind if I just on that scanxiety topic?
Of course, yes, please do.
Yeah, so often patients have a lot of emotions leading up to a test, leading up to a scan, and we can always say as much as we can say about trying to relieve that stress and trying to deflect a lot of that stress onto the providers and let us stress about the scans and you live your life. But I think what Chris is saying is it's very common in patients that have a diagnosis of cancer. And I think it's really, really important. I don't know, Chris, I don't know if you know this, but part of the other reason why I went into cancer surgery is because my dad had cancer when I was 6 years old. And so it's a very kind of soft part in my being to try to alleviate a lot of that stress, a lot of that emotion, and really try to convince patients to try not to focus so much on about the medical and really try to focus on living your life. Because Chris, you may live another 40 years like my dad did, and if you're wasting kind of time that you can really focus your energy on your family, on your life, and really it's hard to kind of separate that. But as a provider, we really try to encourage patients to live their life and focus on their everyday, their quality of life, spending time with their families, spending time with their friends, creating memories, and not trying to focus so much about the medical side and have this kind of being, an afterthought to some point. It's really, really hard to do that early on your treatment. It does get easier as the years pass by, but the more you can practice that early on in your journey, the easier it gets and the less time you waste, stressing over things that hopefully don't need to be focused on too much. But yeah, I just wanted to add that.
I appreciate it. I think those are excellent words of advice, for sure. So just to wrap up, or maybe just in the interest of time, Dr. Hameed, let me just ask you, I know you've been very involved with CRAN, and we thank you for that. I know you were involved in fundraising this year with CRAN's Bum Run, but tell us about your experience with CRAN and sort of from your perspective, the work that they do, the valuable work that they do.
Yeah, I think CRAN, I've probably been with CRAN for about 2 to 3 years now. And, I think from a patient advocacy perspective, it's unlike any other organization. There are a lot of organizations that are trying to promote colon cancer research and awareness and fundraising, but the advocacy that CRAN is doing, with regards to the symposiums, with regards to the these biannual or more seminars, the fundraising of the Bum Run, and getting this network of experts together and patient experts as well, to advocate for other patients and to talk about their experience. I think it's just remarkable how much it's grown over the last 10 years. And I'm happy to keep and keep pushing the boundaries of what CRAN can achieve, and and really try to help patients advocate for, as Chris was saying, trying to lower screening age and other things in this population.
Thank you. Yeah, and thank you again for all the work that you've done to support CRAN. So, Chris, let's wrap up with you. We really appreciate all that you've shared. It's been terrific. Any final words of advice for patients? Anything you want to reiterate just to wrap up our session today?
Well, I think it's hard to put it into a simplified word, but at the end of the day, there's hope. There's a lot coming. There's a lot of new treatments. There's a lot of positivity in your future, even if you don't see it in the moment. In my case, we were blessed through treatment using immunotherapy to have our second child. So he was conceived through all of this, and that tends to be, the guiding light. Some of the positive, the silver lining that can come from a very difficult struggle. But my words to anybody going through this is fight, find your team. Make sure you're comfortable with that team and that you trust them, because you need to trust the people who are looking after you and your future family. But ultimately, fight. It's worth it. It is difficult at times, but we have an amazing resource in our public health care, and it's something that I'm not sure all the time is as appreciated as it should be. If this happened in my case, living in the U.S. potentially, I may not have got the same treatment options, or if I had to, I may have had to sell off my assets or my family's assets in order to attain that. So for those fighting this awful disease right now, you're not alone. Number one, you can find me on LinkedIn or any social media. Feel free to reach out at any point. I'm more than happy to connect with anybody, share my experience and positivity. But ultimately, fight your team, find the positivity. Be with your family. As Dr. Hameed mentioned, make sure you try to find a way to separate what you're dealing with medically and the rest of your life, because the rest of your life does go on. And the sooner you can get yourself to a place where you can, at least attempt to separate those two things, I think is really, really important. But you got a lot of help out there. There's a lot of great people, and there's a lot of amazing professionals who've dedicated their lives. For many instances, much like Dr. Hameed spoke about in his own case, whether it's personal or somebody direct. We have an amazing group of professionals, and we just have to support them, work with them, I think is really important, and find the positivity that they're giving you, because they are on your team. And I'm a perfect example of somebody who has developed the utmost respect for people like Dr. Hameed, Dr. Myers, and our entire system. So I don't know if that was what you were looking for, Ryan, but I want people to be positive, and I think it's really important that they are, because we're not in the old days of treatment anymore. We're starting on the new horizon. It's really important for people like myself and others who are living through it. Share your voice, create awareness, make sure people understand that the fight is winnable. And I think that's a very, very important element to anybody who's going to have to go through this path down the road.
Absolutely. Okay, great. Thank you, Chris. Thank you, Dr. Hameed. That was great. That was great. You guys were terrific. Thank you.